Have you or someone close to you undergone cataract surgery but still need to wear high-powered glasses? And now you're wondering, can the lens be changed after surgery? Well, you are in the right place. Today we are going to talk about this topic. So let's get started. First of all, is it possible to replace the lens? Yes, it is absolutely possible. But doctors usually recommend that if you're planning for a lens exchange, you should ideally do it within 3 months of the initial surgery. Now you might be wondering, why is that? Here's what happens. Our eye has a thin bag where our natural lens sits. During cataract surgery, this natural lens is removed and an artificial lens called IOL is inserted in the same bag. After some time, the artificial lens sticks to the capsule, so if you plan a lens exchange much later, it becomes risky. The capsule might tear during the surgery. Now let's discuss the situation where you might need a lens exchange. First, wrong power calculation. The power of the lens to be inserted into your eye is calculated through a test called A-scan. This test helps decide the best lens power to reduce the need for glasses post-surgery. But sometimes when the test isn't done properly, the patient isn't cooperative, or there are other issues in the eye, A-scan doesn't come accurate. Rarely, even if everything is done correctly, you still end up with a number. This is called refractive surprise. It can happen because of many reasons. Your eye shape may be different, there could be a design issue with the lens, or there might be a manufacturing error. It's hard to identify the exact cause, but it can be fixed, so no need to panic. Second is wrong lens design. Sometimes people get different designs in each eye, like a monofocal in one eye and a multifocal in other. This should be avoided. It's always better to get the same lens type in both eyes to avoid problem. Third is choice of lens type. Many patients get monofocal lenses in both eyes and later regret, saying that they didn't know there are other lens options like panfocal, EDOF or multifocal that can give clear vision for both distance and near. On the other hand, some young patients who do a lot of driving end up with multifocal lenses and later face problems like glare and halos which affect their daily life. Now let's talk about the solutions. First is lens replacement. The artificial lens placed in your eye can be replaced with a new one that better suits your needs. But as I mentioned earlier, if the lens has already stuck to the capsule, this can be risky. So always consult your doctor to see if the option is safe for you. Second is LASIK surgery. If you still have a number even after artificial lens implantation, LASIK surgery can remove this number. It's safe and painless procedure. At EyeMantra, LASIK surgery starts from just 12,000 per eye. But note that LASIK only corrects distance vision, not the near vision. Third is Sulcoflex lens. If you want to get rid of both distance and near glasses, you can go with Sulcoflex lenses. They are special lenses placed over your existing artificial lenses. So instead of replacing the old lens, we just add a new one to correct your number completely, so no more glasses. If you are also facing blurry issue or any other issue after cataract surgery, feel free to call our helpline number and book your consultation. For any other problem or query related to eye, feel free to leave us a comment.